I'm going to start with a brief description of the categories of instruments used during the Cesarean section. There are 4 major categories of instruments used. Clamps, used to hold or grasp tissue. Retractors, used for exposure. Scissors, which are used for dissection. And tissue forceps, used for grasping. The instruments presented here are examples of what you might find in a Cesarean instrument tray. It's important to obtain the instrument list for the Cesarean tray at your facility and be able to identify each of the specific instruments by name. I will try and present the instruments as they are used in the surgery. Allis Clamp has sharp teeth used to hold or grasp heavy tissue and is used to test the spinal by pinching the skin. It can be used to tag the corner of the fascia for better visualization as well. The knife, a large curved cutting edge and unsharpened back edge. The number 10 is one of the more traditional blades used for making large incisions in the skin and subcutaneous tissue, as well as cutting other soft tissues. It is used for the skin incision and to nick the fascia in the midline for subsequent cutting. Forceps with teeth, also called tissue forceps or rat tooth. It's an instrument with teeth used to grasp tissue and is often used to grab the fascia. Curved Mayo scissor. The curved blade allows for deeper penetration into the wound when cutting through the fascia or uterus, used for fascial and rectus sheath dissection as well. Roux Retractor, double-ended retractor with curves on each side, comes in different sizes used to retract tissue and used to help visualize when dissecting fascia from the rectus muscle. The Kocher has a single, heavy-toothed tip used for grasping tough tissue, is used to grasp the fascia. Right angle retractor, also called the Richardson retractor, which comes in large and small, retracts deep abdominal incisions and is used for intra-abdominal and uterine visualization. The Bladder Blade, a retractor used to retract the bladder away from the uterus. The Alexis Retractor, used for visualization in the abdomen and useful for the obese patient. The Metzenbaum scissor, also called the Metz, used to cut delicate tissue and for blunt dissection, can have either straight or curved blades, and is often used to dissect the bladder flap and the peritoneal entrance and can be used during the tubal procedure. Smooth forceps. There are no teeth, used on delicate tissue and often used to grasp vessels and cauterize. Yankauer Suction Tip, typically a firm plastic suction tip with a large opening surrounded by a bulbous head and is designed to allow effective suctioning without damaging surrounding tissue. The Bandage Scissor, used to cut umbilical cord and to sometimes open the uterus without causing inadvertent injury to the baby. Kocher Clamp, all-purpose clamp, can be used for trailing placental membranes or to pull on umbilical cord or to clamp the cord for cutting and cord gases. Ring forceps, sometimes called a sponge stick, grasping instrument for large objects or sponges, can be used for trailing placental membranes. Lap sponge, large cotton sponge with a radio-opaque tag attached, used to wrap and hold the uterus, sweep the uterus of blood and placental membranes, and to irrigate the pelvis. The Pratt Clamp, also called a T-clamp, occludes bleeding, used at uterine wound edges of hysterotomy until able to stitch. Pennington Clamp, occludes bleeding, also can hold the uterus at the wound edges of the hysterotomy. Russian forceps, used to grasp dense tissues, also used to grab the uterus during the hysterotomy closure. The needle holder holds medium to large heavy suture needle. Different needles will be used at your site. Some sites use CTX for the uterus, CT1 for the fascia, and a 3-0 monocryl for the skin. Straight Mayo scissor, typically used for cutting sutures. Poole suction, used to remove large quantities of fluid from surgical sites during procedures. It is often used during abdominal procedures, and it has multiple holes so as to best prevent blockages caused by fat or tissue suction during a procedure. And it is used for irrigation as well. Army-Navy retractor has two L-shaped ends and is used to retract shallow or superficial incisions. In the cesarean surgery, it is used for visualization when closing the fascia, along with the Roux Retractor at times. Bonney Forceps, grasping heavy tissue such as fascia, often used when doing a vertical closure. Adson Forceps, used to grab soft tissue and used during the skin closure. Snap, also called a hemostat or a Rhode Island, clamping and including bleeding vessels, or holds ends of suture of hysterotomy to better visualize the uterus, also used to occlude and cauterize vessels. The Babcock, finger ring ratcheted non-perforating forceps used to grasp delicate tissue, used to dissect tissue surrounding the fallopian tubes and sometimes used to look under the bladder flap. Bovie, used to cauterize vessels throughout the procedure. Other videos in this series will cover how to hold and use the instruments described here.